members, I want to begin my remarks by thanking all those CUPE members who've come in from Campbellford, who've come in from Oshawa, who come in from Ottawa, Sturgeon Falls, Kenora, Hamilton. I want to thank all those who come in across the GTA for being with us here today to send this signal to the Liberals that CUPE and APSU and the rest of the allies in the Labour movement and our community partners are going to fight these hospital cuts right across Ontario. And here today, we see the Rouge Valley health system as ground zero in that battle against these unfortunate cuts by this government. You know, there's a sign down here that talks about, it's a slogan that's used by the Rouge Valley health system. It says it's in our nature to care. Well, let's just talk about that for a moment. When they moved 36 beds, mental health beds, from the Ajax Pickering Hospital into the so-called community. Let's remember what happened the last time a government stood up and said, we're going to move mental health beds into the community. Take a look at the streets of Toronto. Take a look at the homeless folks as they march around in the city of Toronto, homeless, without any services, without any help. Indeed, you don't even have to go into the city of Toronto. Take a look at any one of our communities. Take a look where I live out in the Oshawa region and see the people sleeping in the parks, sleeping in the streets, because they were told by a previous government, Harris, that he would move healthcare services into the community, particularly for mental health patients, and he did not. And today we've seen a proliferation of the homeless populating our streets. Sisters and brothers, that's the kind of healthcare reform that this government is talking about. At a time when we know we've got some serious problems with superbugs in our hospitals, MRSA, C. difficile, killing people in record numbers. This hospital behind me is moving into a dangerously high occupancy rate, which we know when you lay off frontline workers like the cleaners and nurses and PSWs, we're going to increase the risk of superbugs to patients who end up in these hospitals. We know that's a healthier risk, my friends. We know that going into a hospital now in Ontario is a serious risk to your health in a major way, and we're talking here about death. We know in the West End that in one of those hospitals in the West End, 65 deaths alone in the last year due to C. difficile. CUPE has a campaign demanding that the government release the figures across this province, that we show to the public the danger of these superbugs and how insane it is to be laying off frontline workers at a time when we're seeing massive amounts of deaths in the hospital system. That's wrong, my friends. At the same time, we have this oxymoron of an organisation called LINS, Local Health Integration Networks. Nothing could be further from the truth. They're taking services out of the local community and dispersing them far and wide so people will not be able to get access to the system. The Ontario Liberals, just in the last number of months, put in a paltry 2.4% of an increase for hospital services in the hospital services budget. The LINS turn around and they take 1% of that 2.4%, which, by the way, the 2.4 is already below the rate of inflation. They take 1% off the 2.4% and they say we're going to put that into the community. There goes that little oxymoron again. They were going to put it into the community, but in fact we know it's all about privatising those services. They're looking for cheaper ways of delivering the services, which means let's find people who work for $10 an hour. Let's find somebody who's got no union. Let's find somebody who's got no pension plan. Let's find workers that we can exploit. Let's find new Canadians and we can stick the boots to them and they won't know any different. They'll think it's great to be coming to Canada to work for $8 an hour. No, my friends, there's got to be a different way of delivering healthcare services in this community of ours and all across this province. We have to make a stand. This has got to be ground zero. We've got to get all of the unions, OPSU, ONA, CUPE, CAW, SEIU, all working with the community, work with the Friends of Ajax, work with the Ontario Health Coalition. We've got to make the Liberals pay the price for what they're doing, sisters and brothers. I sincerely believe we can do that. And communities in southern Ontario. We're going to have some rockathons. We're going to get some bands. We're going to get April Wine and Trooper and Kim Mitchell. And we're going into our communities. We're going into those communities and saying, let's have a free concert. Let's stand in solidarity with the hospital workers and the community services. Let's get 7, 8, 9, 10,000 people from Oshawa Ajax in the community to come out in August and stand. Let us go across the province and politicize people with free concerts in their communities and deliver a hard message that yes, we're doing this as a community service, but by God, behind it all is the ultimate of community services. Make sure that every man, woman and child in Ontario has access to a decent healthcare system in this province.